Okay, hello everybody, this is Milad, and today I'd like to talk about differences between the healthcare system in Finland basically with other countries like Iran or USA or Canada. So I've been living in Finland for almost 3 years now, and it's been a challenge for me to understand the healthcare system, to see how it works actually, because there are a lot of differences between the healthcare system here and what I experienced back in Iran. So basically, my born country is Iran, and I moved to Finland almost 3 years ago. So basically, the comparison is between these two countries, and pretty much I can say that the healthcare system in other countries in Middle East, like Turkey, is pretty much similar to what we have in Iran. Also, I'd like to compare it a little bit with Canada or USA. I don't have actual experiences there because I've never been there, but I've heard a lot about the healthcare system there, and I've watched a lot of videos about it, so maybe I can talk about the big differences there as well. The reason I'd like to talk about this is that basically for the last few days I've been sick. Basically it was a really simple flu, but it was normal in the beginning, but then it became worse and worse until I got a lot of pain in my neck. Basically, I had a neck ache, and in the end, I realized that it's something called occipital neuralgia. It's a medical term, I believe. So I decided to actually start talk about these things because it's really important, especially for immigrants, for people who want to move from one country to another, especially for those who want to come from Eastern countries or from Middle East to European countries. So I think it's gonna be good. So if you think something's wrong with the things I'm going to say, or if you think I'm telling some bad information, let me know. Please correct me in the comment below. So let's start. The very first difference you see if you want to compare the healthcare system between these basically three types of countries. In Iran, the healthcare system is really fast. If you want to get a doctor, you can get it really fast. If you want medication, you can get it fast. If you need a surgery, the doctor, after a couple of appointments, they give it to you right away. You don't have to wait in line for months and months for that. But what I experienced here in Finland is that basically, even for simple medicine like this, antibiotics, for the antibiotics, it's not really easy to get. If you go to a drugstore, they're not gonna give it to you without prescription. If you go to a doctor to get a prescription for antibiotic, for instance, you in some cases when you get sick, when you have sore throat, basically pain in your throat, in some cases you need antibiotics. So in Iran, you just directly go to drugstore and basically say, I need some amoxicillin capsule. It looks like this, and they give it right to you without any prescription. But in European countries, in Finland, or also in Canada or USA, I think this is like this, that they don't give it to you. So even if you go to a doctor, they're gonna run a lot of experiments on you. You have to give some tests, laboratory tests, to make sure that the bacterial level of your blood is to a level. If it's above that level, the doctor is gonna prescribe you some kind of antibiotics. But if it's below that threshold, they're not going to give it to you. I had this experience, actually my wife had this experience, that she had really bad pain in her throat. She went to a doctor and they told her that she needs to go to the hospital. We went to a clinic. We needed to go to the hospital, to the emergency room, and they need to take some tests. They need to run some tests. Then after that, maybe they give you the antibiotics you need. But after a couple of hours doing all kinds of tests, eventually they just gave us a bunch of pills, which wasn't really necessary for that amount to do all those things. And the long process actually made my wife even worse. If it just stayed at home and tried to be relaxed and rest at home instead of going to a doctor and going to the hospital, she would become healthier sooner. So the long process made her symptoms worse. Instead of that, we got some pills that eventually wasn't really helpful. The main difference is here that the process is long. And the very first reason is that they need to make sure that you need this medicine or you need this procedure or you need this surgery. This can be something good, this can be something bad in some cases. So we've seen some cases that doctor doesn't approve a medicine or surgery and the patient needs to wait a long time to get that, and when they get the medicine or the surgery, it's too late for them. You know, we've seen a lot of these things. Also, back in my country, in Iran, there are cases that because there wasn't enough tests there, and because of this reason that the doctor didn't run some normal tests and didn't do the experiment well, they just prescribed a wrong medicine or prescribe a wrong surgery or procedure that didn't end well. Basically, I'm something called false positive in medicine or even in machine learning. When you want to run some tests and train a model on a data set, a medical data set especially, there is a false positive thing. It means that doctors prefer to not give some medicine to some people that need it rather than giving some medicine or prescribing some surgery or medicine to some people that actually don't need it. For instance, when it comes to antibiotics, they say that, well, if there is a chance that you need it, for instance, there is a 80% chance that you need these antibiotics, but our threshold is 90%. So we don't give it to you. So now we don't give it to you, and it's not important. It doesn't matter because after a few days, you're gonna be well. But if you don't need it, and if we prescribe it antibiotic, it is really bad for your health. So in the long run, after a few years, if you try this practice, it's gonna be good for you. But if you try to take antibiotics once in a while, after a couple of years, if you use it for wrong reasons, it's gonna be really bad for your health. Okay, so it was about the slowness and fastness of these kind of healthcare system in these three countries. So Iran is fast, Turkey is fast. When it comes to Finland, it's something in middle, in between Iran and USA and Canada. USA and Canada is too slow. This is what I learned. The other thing I like to talk about is basically the expenses. So in Iran, because all the expenses are based on the Iran's currency, which is reals, when you compare it to euros or dollar, the expenses are really low. Also in Turkey, when you compare lira, it's much cheaper for a lot of people to go to Turkey to do some surgeries, especially those surgeries that are related to beauty and face surgeries or hair growing, this kind of stuff. I've seen a lot of people go to Turkey. Also, a lot of people go to Iran as well to do this kind of things because it's really cheap there. But for the Iranian itself, because the average people are living based on low income, they don't have that much money because of a lot of issues they are facing. The currency is not really valuable though in comparison to yours. So if you want to compare it, still it's a little bit expensive. But it's not as expensive as what we have here in Finland. If you want to pay it yourself and if you want to have the treatment in private clinics, it's going to be expensive. But the good point here is that actually we have public sector. With having public sector, you can have all kinds of benefits. You can get appointments in public sector and you need to wait a little bit in the queue, in the line, but eventually you're gonna get it. Also, because of this public sector, well, we have a lot of good private healthcare insurances. And because we have those healthcare insurances, pretty much they can cover all the issues. They don't cover dental issues, but when it comes to your basically emergency things, emergency illnesses, they're gonna cover it. All the tests, all the medicine, all the doctor appointments or the surgeries you need. For instance, for my wife, last year I paid 350 euros, I believe, for 1 year, which is really good. All the costs and expenses, if I wanted to pay myself, it would cost me around maybe triple or 4 times more than what I paid with the insurance. That was a good point about Finland. Public sector healthcare insurances, which we don't have it actually in, it's not really good in Canada or USA based on what I've heard and what I've seen. And the big problem in USA is that they don't have a really good healthcare system. Well, they have a lot of private insurances, and if you have a job, well, you can get support there, you can have occupational health insurance, which is really good. But I think when it comes to private insurances and public sector, Finland is in a really good position. Another thing about Finland is that basically everything here is based on clinics. So you can find doctors individually with their own name, you know, with their own brand or with their own small clinic. It's usually big companies, big clinics, big hospitals, private hospitals, while in Iran, for instance, or in other countries like US or Canada, draw a lot of private hospitals and private clinics, big clinics, but also you can find doctors individually. They have their own private facilities. Now the last part I'd like to talk about is about getting medicine here. Is that the difference? I'll already mention that, well, if you want to get antibiotics, it's not really easy. You can't get it without prescription. You need to go to a doctor, and then after running some tests, they may prescribe with that. So what you can get here if you're ill, pretty much what usually they suggest you when you go to a drugstore, it's painkillers. So we have all kinds of painkillers here. Brana, ibuprofen, the brand is Brana or Pandol, but it's usually ibuprofen or things that are including acetaminophen. So it's all painkillers, all kinds of painkillers here and there. So basically they prescribe that. When you have sore throat, sometimes they just give you this, which is just to make the pain go away, and that's all. And you need to wait for the illness to go away by itself. So there isn't that much you can do. One thing that I understood over the past few years basically is that you need to learn a little bit about all kinds of illnesses, about all kinds of medicines yourself, and when you get to know your body and about what you need to do about your healthcare, it's much easier to deal with a lot of normal disease. For instance, when you get a flu or when you catch a cold, there is no actually any treatment for that. You just need to relax, you need to eat good food, you need to take some painkillers to just make the pain go away, you need to drink a lot of fluids, and that's all you can do. So that was pretty much my experience and what I've learned. I hope this is useful for you. Please leave a comment for me if you found this interesting. Thank you so much. See you. Bye bye.